Hi all, have a great day. Today I am going to discuss about the basics of ultrasonography. Ultrasonography is a very important modality in imaging the children and also the pregnant patients. We know ultrasonography uses ultrasound waves, and ultrasound waves are non-ionizing radiations unlike X-rays, which are ionizing radiations. Non-ionizing radiations are very helpful because the ionizing radiations are very much sensitive for rapidly dividing cells. In pediatric age group and in the pregnant patients, we have rapidly dividing cells. So they will be very sensitive for ionizing radiations, and that can lead to lethal damage. So the best is the non-ionizing radiation, and hence ultrasound plays a vital role in diagnosing the normal and abnormal things during pregnancy and in the pediatric age group. And also it is the modality of choice for gallbladder related diseases. So I would like to first tell the basics of the ultrasonography. We know ultrasonography is a form of mechanical energy. It has dual propagation method. One is in the form of waves and the another is in the form of rarefaction and compressions. Here you can see I want you to know certain basic physics terms to understand ultrasonography and the related applications better. So here you can see, this is the sound wave, and you can see this is the waveform, and these are the compression, and this area is the rarefaction form. I need you all to know what is wavelength. Wavelength is the distance between two successive crests or troughs. This is the wavelength. Okay, and this is a symbol for the wavelength. These areas are rarefaction and these dense areas are called as compression. Any number of oscillations per second is called as frequency. Frequency is number of oscillations per second, and it is expressed in terms of hertz. 1 hertz is 1 oscillation per second. So wavelength is the successive wave crest, frequency is the number of oscillations per second, and 1 hertz is 1 cycle per second. Why all these are important? Because the velocity of sound depends on the frequency, wavelength, and also the density through which it travels. So characteristics of the sound. Audible sound range is in the range of 15 to 20,000 hertz. Any sound which is under 15 hertz is called as infrasound, and any sound with a frequency above 20,000 hertz is the ultrasound, and this ultrasound waves are used in ultrasonography. So diagnostic ultrasound uses the frequency in the range of 1 to 20 megahertz. So the sound waves we would have seen in our younger age group that the sound waves travel fastest in the solids and slower or very nil in air and in vacuum. This is very important physics concept that we are using in ultrasonography, because before seeing the patient we will apply a gel over the patient and then we will put the transducer. This is to replace the air layer, and also it acts as the matching layer between the transducer and the patient's surface. So why I am telling this is, you just remember sound travels fastest in the solids and slowest in the air and vacuum. So the average velocity of sound in the soft tissue is 1540 meter per second. This is again MCQ question. The average velocity in soft tissue is 1540 meter per second. Higher values are noted in the bone and metal, lower values in the lung and air. Difference in the velocity is noted at the tissue boundaries, and this is the basis for contrast that we see in ultrasound image. Because of the difference in the density between two structures, for example, a stone will be there inside the gallbladder. Gallbladder contains bile and there is stone. So there is difference in the density between the bile and the stone, and this difference in density plays an important role to form the ultrasound image. So 3 important things that you should keep in mind are velocity, wavelength and frequency. Wavelength and frequency are very important for resolution because high frequency provides superior resolution, but the attenuation is more. Now I am introducing another term called as attenuation. Attenuation is the loss of energy when it enters the tissue. For example, I am seeing a structure like thyroid. I use higher frequency probes because higher frequency will have more attenuation, so it can't be used for deeper structures. It can be used only for superficial structures. So remember, for superficial structures we use higher frequency probes. Okay, so higher frequency probes will have shorter wavelength, whereas lower frequency probes will have longer wavelength, and that will be used for deeper structures. In abdomen and for obstetric images we use lower frequency probes. Next, I am introducing another term called as acoustic impedance. Acoustic impedance is the product of density and velocity. So air and lung media have lower acoustic impedance, whereas bone and metal have higher acoustic impedance, because it is a product of density and velocity, density of the tissue and velocity of the sound waves. So we can know that in bone and metal there will be higher acoustic impedance, and in lungs and air the acoustic impedance will be lower. So there is a compound relationship between all these things that we need to understand before choosing what frequency probes we use. That's why I am telling the basic concepts of all these things in this ultrasonography section. So what is the machine shown in this image? So this is the ultrasound machine. You can see there is a monitor here. This is the monitor. You can see this is the working area with multiple knobs. These are the probes. Here one probe is there, and this is another probe. Here you can see another probe. These are all the probes, and these are the areas where the probe is connected. So what happens? These are the key components in the ultrasonography unit. You have a probe. You are going to use this probe on the patient, and these probes are going to produce the ultrasound waves. These ultrasound waves are going to be passed into the patient, and they will undergo changes like what we had seen in X-rays. They can interact with the matter, and the returning ultrasound waves will be picked up by these same probes, and they will get digitalized and form image in this monitor. So the key component is the transducer. What is transducer? It is the device which converts the electrical energy into the mechanical energy, and again the mechanical energy into the electrical energy, vice versa. So what is there in the transducer? Transducer contains a crystal called the piezoelectric crystal. What is the purpose of this crystal? When we apply electricity, these crystals will undergo vibrations, and that vibrations produces sound waves. They get deformed, they change their shape and produce some sound waves. These sound waves pass into the patient, and again some interactions take place, and the returning echoes are again collected by these transducers. They undergo vibration again, and they convert them into the electrical impulses. That electrical impulses are fed, and it leads to the formation of the image. So this is the purpose of the transducer, and transducer is the key component in the ultrasonography unit. There are many crystals which can be made up of single element, or there will be multiple areas of crystals that can be used, and the range of frequency that can be produced in a crystal also is broadband and narrow band. For example, a crystal can produce certain frequency of ultrasound, and that's why we use different transducers. For superficial structures we use higher frequency transducers. So those crystals will produce the sound waves in higher frequency, whereas the curvilinear probes, those we use for deeper structures, and they produce lower frequency ultrasound waves. So this is the purpose of the transducer. What happens to the ultrasound waves when they enter into the patient? They can undergo reflection, absorption, refraction and transmission depending on the nature of the tissue. For example, air. We already saw air is a poor conductor of the sound. So it will not allow any ultrasound waves to pass beyond it. So there will be a shadow behind it, and that shadow is called as dirty shadowing. Whereas if you see liquids, it will admit all the ultrasounds to pass through, so that area will appear dark. If solid structures like liver and spleen, they are soft tissue structures, they will appear grey. Whereas bones and stones, those are hard structures that will reflect the ultrasound waves or completely absorb. They will appear bright. But what happens behind them is they will produce a shadowing behind them. That is called as posterior acoustic shadowing. So remember, the term used in ultrasound is echoic. The structure which appears completely dark is called as anechoic. A structure which appears completely bright is called as echogenic structure. And intermittent will be other soft tissue, grey color. And if you want to describe any lesion in relation to other structure, then you can call it as hypoechoic or hyperechoic. For example, you are seeing a lesion in the liver and you are going to tell how the lesion is. So you are going to describe it in relation to the liver. So I will describe a well-defined hypoechoic lesion is seen in the liver, in the right lobe of the liver. It means the lesion is darker than the liver. Hypoechoic means darker shade. Hyperechoic means brighter shade. Just remember the terms used in ultrasound. We use echoic, anechoic, hypoechoic, hyperechoic, echogenic. And two things which are happening because of the interaction is posterior acoustic enhancement and posterior acoustic shadowing. If ultrasound waves pass through a stone, there will be a shadow behind it because it will not let all the ultrasound waves to pass. It will either reflect or absorb. So there will be a shadow behind it. That shadow will be dark in color. So you are seeing something bright with something dark behind it. Then you will call it as posterior acoustic shadowing. Whereas you are seeing bladder or gallbladder that contains fully bile, full liquid. So ultrasound waves you are allowing. It is all the ultrasound waves are transmitted. So what happens is the structure behind that will appear bright because it allows all the ultrasound waves to pass. But the structure as such will appear dark. So that is called as posterior acoustic enhancement, which you will see behind a cyst, behind gallbladder, behind anything that contains liquid. So this transducer contains piezoelectric material. What is it made up of? Initially it was made up of quartz, but now the piezoelectric material what we are using is made up of lead zirconate titanate. The other structures that can be, the other material that can be used for this transducer are plastic polyvinylidene difluoride, PVDF. So this is again a potential area where the question can be asked. So the commonly what piezoelectric material we are using is lead zirconate titanate, but other piezoelectric material that can be used is PVDF, nothing but plastic polyvinylidene difluoride.